My name is Brian Van Hook, and I'm Regional Director of the Florida Small Business Development Center at FIU. We're going to have the webinar today. It's approximately 35 minutes. I'm going to save some time for questions and answers. I see that we already got some Q&A posted, and I'm going to cover for you. I know there's a lot of anxiety from small businesses about the reopening, the different instructions, kind of like considerations. So what we're going to do is we're going to go over kind of the general information on a phased reopening, kind of like the federal, the state, and the local, but we're going to emphasize more of the local instructions. Then we're going to get into a lot of the considerations that small businesses are going to need to take into account, and also cover a lot of the marketing, a lot of the business strategy, a lot of the long-term considerations. So we're going to kind of move pretty quick, and I'm going to save a lot of time at the end for questions from you guys. So I had to switch because I had a little bit of audio issue, so you see my headphones on, but let's go ahead and get started because I want to be sensitive to you guys' time. So as I mentioned, I'm Regional Director of the Florida Small Business Development Center at FIU. We're under the College of Business. I'm originally from Louisiana. I'm a certified business continuity professional, and I have 15 years of disaster recovery and business continuity experience. As you can tell with my headset, I think on my feet. I'm used to responding to disaster situations like this, so you got to be resourceful. And I've worked on a number of disasters previously. In terms of SBDC, we have a team of 17 business specialists. We focus on business growth, and we work one-on-one with your business to help you grow, whether that's to get capital, to get a contract, and increase revenue, hire more people. And we have a really great team that's been very successful helping businesses. On an average year, we work with about 1,000 businesses, and we focus on kind of like improving your business. But obviously we can't do that if you're impacted by the pandemic, by a hurricane, or business interruption. So like a lot of other groups, we're focused on helping businesses to get capital, kind of come up with marketing strategies, kind of get reopened so that they can continue doing business and also adjust to the new normal. We're part of the Florida Small Business Development Center network, and we are an SBA resource partner. You can see that we cover basically Miami-Dade County and Monroe County. If you're not in one of those counties, don't worry. We do have other SBDCs around the state. So let's get into COVID-19. So any discussion about COVID-19, you do have to cover kind of like some of the things to protect yourself. By now, everybody knows this. It's been kind of like drummed into our heads, but you need to protect yourself by frequently washing your hands, using hand sanitizer if you're not able to wash your hands. Cover your cough with the bend of your elbow or a tissue, kind of like Dracula, I guess is the analogy people use. And then also maintaining that social distance of 6 to 8 feet from people so that there's less of a likelihood of getting a transmission. I did include up there some information from the Centers for Disease Control so that it's a really good fact sheet for hand sanitizer and hand washing that's available. And don't worry, after the presentation, my colleague Brianna, she's gonna send you the PDF of this presentation so that you can have a lot of the links. In terms of your business, you do need to provide environmental cleaning on your business and your facilities. The CDC is recommending that you frequently clean any touch surfaces in the workplace, such as workstations, countertops, doorknobs, elevator buttons, things like that. But use the regular cleaning agents that you use. Don't buy anything super toxic or something fancy, but just follow the directions on the label. And kind of just do routine cleaning. Obviously, anything that's high traffic or used a lot or by multiple people, you need to clean it and disinfect after each use, whether that's cash registers, counters, things like that. Disposable wipes are probably the best way to go for cleaning that. Obviously, you want to use a glove and mask when you're cleaning, and then dispose of any kind of disposable gloves or anything that you use. And for the business's perspective, you need to check your maintenance contracts and any cleaning supplies that you have, because you're going to have increased demand and increased usage for it. But I would really encourage you to check out the CDC's interim guidance for businesses. It's a really great resource, and it actually does get into specific industries and considerations that you need to follow. So I'd encourage you to check out the CDC website. It's a really good resource for businesses. So let's get into phase reopening. The phase reopening is, as it denounces, it's 3 phases, and it's been 3 phases at the federal side, 3 phases at the state side, 3 phases at the local level. So I'm not really going to focus more on the federal and state because I want you to get the information that's going to help you, and that really comes from the local governments. But you need to be aware of the occupational risk. Obviously, healthcare workers, morgue workers, any healthcare delivery, medical transport, any large gatherings such as movie theaters, sports centers, those are high risk. Medium risk is anything with contact with people, such as retail, restaurants, things like that. Any lower exposure is people that can do jobs remotely or work from home, like a lot of us are doing. But that's a really good kind of risk pyramid that's available at the OSHA website. In terms of a phase reopening, the White House did release its guidelines for a 3-phased approach. They talk about how it depends on local conditions and industries, but they need to see a decline in cases for 14 days. This reports of symptoms that might represent undiagnosed cases also in decline for 14 days, and that hospitals in the state should have enough capacity to handle cases without operating in crisis mode and testing those healthcare workers. So I'm not going to dwell too much on this because really it's more important to do on the local level, but I do want you to make you aware of kind of what the federal government has set up. So obviously phase 1 is restaurants, movie theaters, sporting venues, elective surgeries, things like that. Phase 2, restaurants, movie theaters, other large venues. Non-essential travel can resume, bars can operate with diminished standing room. And then phase 3 is employers can have unrestricted staffing in the workplace and large public venues can operate. But I would reiterate a couple times that this is dependent on local conditions, and actually local governments and states have shown that they can be more strict than this. But if you want more information on that, I do have the link to the White House's plan on their website. That's available there, so you can read that in more detail. In terms of Florida, basically in Florida on April 29th, Governor DeSantis did announce his plan for Florida's recovery. It was focused on public safety and health, protection of the vulnerable, economic recovery, partnership with the local communities. Phase 1 of that plan began on May 4th. Initially, Miami-Dade, Broward, and Palm Beach were excluded because there was a number of high COVID-19 cases. But there have been some developments since that time, and openings in those counties did begin on May 18th. Monroe County actually was not part of those exclusions, so they did open, at least locally, at that time. And we'll get more into the Keys and Monroe County in a minute. Components of that state plan, which was subject to local governments, was restaurants can open at 25% capacity. For indoors, retail can open at 25% capacity. Hospitals and surgical centers can restart non-essential elective procedures. Obviously, elderly and those with underlying health conditions were encouraged to still shelter in place and don't socialize in groups of more than 10 people. Bars, gyms, and movie theaters were still closed. And I did upload there, you can see the governor's executive order, which was 2112. I did put the link there so you can review that in more detail. But I really want to spend more time on the local guidance because that's really what's going to impact your business. In terms of the Keys, Monroe County, as I mentioned, was allowed to reopen some businesses as part of phase 1. The Keys, as I do the presentation today, is still closed to visitors, but it will be reopening for visitors on June 1st. So they do have some checkpoints that are set up, that they've been reviewing identification, ensuring that there's homeowners and that they have residency documentation. They were also doing screenings at Key West International and Marathon airports. But Florida Keys lodging businesses can begin accepting reservations, but they can only honor them starting June 1st. Retail businesses have already been operating, and they've been allowed to operate at 50% capacity with proper social distancing and safety procedures. And then restaurants can operate at 25% capacity indoors. They had no limit on outdoor seating, provided they did have that 6 feet of space and that parties or groups of 10 or less. So it's pretty straightforward on that. And as I mentioned, they will be open for visitors in June 1st. As of the latest guidance, bars and bar seating was still closed. And bars were defined as any business that derives more than 50% of revenue from alcohol sales. Hair and nail salons, barbershops, massage therapists were able to open, but capacity was limited to 25%. And then they did have that common now guidance that customers should be by appointment only, and you have to schedule 15 minutes in between for sanitizing and cleaning. No group appointments, and then you have to have masks for employees and customers as it's practicable. So I would encourage you to check out Monroe County's website. They have a really great COVID-19 website that has really good instructions for businesses and is really real time. So you can kind of get up-to-date information for your business if you're located in the Keys, or definitely if you're looking to be one of those folks that wants to get down to the Keys as soon as you can and take advantage of all the great bars and restaurants and other things that they have down there when they're reopened. In terms of Miami-Dade County, there was a little more guidance from Miami-Dade County, and there's also some specific guidance because some of the cities had additional requirements and some of their own plans. But on May 18th, the county mayor did announce his plans to allow some businesses to reopen. The plan was called the New Normal. This was a phase 1 plan to kind of get businesses reopening. The businesses that were allowed to reopen with capacity restrictions and safety measures included retail, restaurants, manufacturing, office and shopping centers, arts and culture, personal grooming, and then warehousing and trade and logistics. Obviously very important for Miami-Dade County. I did want to make you aware that for the plan, they did include a color-coded system that they can communicate kind of where they're at. So obviously red is where you have like a lot of the closures all the way down to blue when there's basically social distancing and all businesses and facilities are open. So they kind of did have that range. You're going to see that color-coded system in a minute too. The businesses that are still not eligible to open include movie theaters, gyms and fitness centers, hotels, except for some of those that were exempt in the previous emergency orders, bowling alleys, bars and nightclubs, banquet halls, cafeterias, tattoo parlors. I would encourage you to check out the full plan because they do really get into some good guidance on industry-specific information. And also, they have a lot of really good information from CDC, from OSHA, state of Florida, kind of tucked into their plan, kind of in the appendix section. So it's helpful for businesses to kind of see what they went through. I would note for the bars and nightclubs and breweries, they did have an exception for those if you have a food license. So if you can prove that you serve food and you had a food license before COVID-19, they were allowing those businesses to reopen serving food. They're still not allowed to open for like kind of nightclub situations, but I believe they were allowing it to open as long as there's not bar seating and then you're serving food. And they were allowing them to serve alcohol with that. So that was kind of one thing that wasn't necessarily outlined, but I know a lot of businesses have been doing that. And it should also be noted that a number of cities also did have their own reopening plans and kind of had some additional requirements on businesses in those areas. That was Miami, Miami Gardens, Hialeah, Miami Beach, Doral, and Coral Gables. So I included up there, if you're a business located in one of those areas, you can view their website that has their specific plans. A lot of those plans do track with Miami-Dade County's guidance. A lot of those plans do refer back to that plan, but they do have some more specific local instructions and guidance. So you're going to want to take a look at that if you are located or you do have a location in one of those cities, because you want to make sure that you're following all the local rules and regulations. And then in terms of the county's plan, they did break down the industries into color-coded systems. So this shows you kind of like essential all the way down to those that they have to kind of pay attention to a little more because there's a lot more people coming through. So it goes obviously from the top as essential businesses all the way down to businesses such as hotels, personal grooming, theaters, pools and gyms, bars, community centers. But this helps you to understand the rationale behind what businesses they deem essential, and then also what businesses are going to be reopened during each phase. And this actually was included in the plan as well that I just discussed. In terms of people, the general guidance in Miami-Dade County kind of follows the PPE guidelines that were set up from the state, from CDC, from OSHA, other agencies. Basically, limit your gatherings to 10 or less people, 6 foot distance between people, wear facial coverings, and then also wash your hands or use hand sanitizer often. In terms of facilities, they also set out that facilities must implement certain procedures. That's, you have to do enhanced sanitizing of all common areas and any kind of frequent touch points. You have to place trash containers for PPE near your exits, entrances, and common areas so that people can easily dispose of that. Comprehensive cleaning each night. A lot of the different cities and counties, they do require that you put up that CDC signage. The most common one is that stop the spread of germs. If you basically search for CDC and stop the spread of germs, it's like a little flyer. But they also have some flyers that are like how to put on a mask, how to wash your hands properly, things like that. So I would encourage you to check those out because those are things that they do require, especially under Miami-Dade County's plan, that you do post those for the information of your employees. And so we would encourage you to put that. And it's also for any customers that might get that information as well. They do want hand sanitizer at entry points and throughout your site, and then also training your personnel on your new operating protocols. Let's just get into some industry-specific examples. Obviously, there's a lot of other ones like manufacturing, trade and logistics, arts and culture. You can go through a lot of those. I wanted to focus on retail and restaurants because those are the ones that's got the most scrutiny in kind of the first phase one. For retail, the Miami-Dade County did set out that you have to limit your staff and your customer occupancy to not more than 50%. As you'll see when you go to the grocery store, they are requiring that your cart and your basket handles, that they be sanitized between uses. So it's a good idea to have somebody kind of on cart duty or somebody on basket duty that can do the wipe down so that they can basically kind of do that in between. Also having a single point of entrance where people can come in. So that way you don't have people coming in the out or going in the in. You want basically one point where people can go in and out. Then you also want to have check-in stations for the employees. And we're gonna get into that in a little more detail, but they want basically to have people check in for each shift. And you wanna basically check their temperature. You want to kind of do some health questions for them. And just make sure you're not allowing somebody into the building that might be sick or might be, passing on the virus. You also want to space out your customer queues with floor markers every 6 feet. Facial coverings must be worn inside retail businesses. You want to procure the appropriate amount of soap, hand sanitizer, PPE, cleaning materials. And then this was a new one that I saw, but merchandise must not be handled or tried on by customers. And you have to return it to the shelves or display. You can't do that without 24-hour hold, kind of a 24-hour quarantine or being sanitized. So they basically don't want like somebody putting a sweater on and then basically putting it back and saying, I don't want this. And then somebody else comes by and puts it on. It's kind of, they've come out with guidance that it is a little less likely to catch it in that respect, but you do want to be cautious and take precautions. So that was something new regarding merchandise. So you want to keep an eye on that. In terms of restaurants, actually in the county plan, there was, I want to say 2 to 3 pages focused on retail. And for some of the other businesses, they had maybe 3 to 4 pages. For restaurants, there's about 12 pages. So I would encourage you, if you are in the restaurant business, go to the county plan and basically print that out. It's about 12 pages because there's a lot that you have to do to get back in. It's a lot of important steps and it's going to make your employees and you and your customers more safe, but there are some things you need to get ready. In terms of prepping your facility before you reopen, A key step is that you have to flush the plumbing because a lot of businesses have been closed for a period of time. So you want to get any stagnant water out. You want to change your HVAC filters, or if you have the ability, you want to upgrade them. You want to maximize fresh air, and then you want to change out those air filters more frequently. You have to have a plan on how you're going to address parking. So if you have a parking garage, if you have facility access points, you need to outline the plan. And they were also very specific regarding valet service, like how you're going to handle valet service at your location. So those are things that you want to take into account and actually have a plan, because there might be something where you might be asked for that plan, or kind of what's your procedures. Like I mentioned on a lot of the other things, they want to have self-dispensing hand sanitizer or hand washing stations near the entrance, trash bins with an open lid that people can drop PPE if they need to, gloves or masks or whatever. And then you also have to have a plan for how you're going to dispose of that. In terms of your facility prep, you also want to get those health and safety signage visual aids posted. I mentioned some of those, like stop the spread of germs, kind of like masks, hand washing, things like that. There's a lot of really good kind of one-page sheets from the CDC. In terms of restaurants, you do want to create those visible floor markings for the 6 feet distance in waiting areas, both interior or exterior. And then you also want to have a distinct area for customer waiting, for order pickup and takeout, and any third-party delivery services. So you need to kind of set those aside, because you don't want large groups of people congregating. In terms of operations, before you reopen, they do ask that you have a internal ops meeting between the heads of the units that's going to evaluate the health status of staff prior to reopening, and that they're also going to do it on an ongoing basis to kind of see what's the health status of the team. You need to keep records if you have any unusual rise in worker absenteeism, if you have any positive cases, and then you have to follow the CDC guidelines on closing, notification, deep cleaning, if you do have a positive case. In terms of any shifts, you also do want to assign one person for each shift to monitor health and safety measures that are being taken. So you have one person that's like accountable for that and kind of tracks it. It could be a general manager, it could be kind of like one of your head folks. It just depends on how you structure your operation. In terms of capacity, the Miami-Dade County guidance did limit capacity to not more than 50% with proper social distancing. Outdoor seating can be increased, but the indoor and outdoor total can exceed that 100% of your permitted occupancy. They also did encourage, when you're doing outdoor seating, to make sure that you follow, obviously, any Americans with Disabilities Act, considerations. Obviously, don't block street traffic, don't block, sidewalk traffic. Just be sensitive to that. Tables are limited to a party of 4 unless it's party members from the same household. If that's the case, they can go up to 6 persons, but that is a process that you need to have your hosts kind of implement, to ask if they're together, if they're a household, so that you can make special arrangements for that. And it might even be something where you want to set up tables of 4, tables of 6, where you can quickly get them over and you don't have to move chairs around. They also do encourage that tables are arranged with the backs of chairs, so this chair and this chair, that they're 6 feet apart, and that guests are distanced at least 3 feet apart from each other at the table, so that you do have that proper spacing. Bar counters are still closed to seating. In terms of your employees, all employees must wear masks. Gloves are required for those that are in direct food preparations, but anybody that's likely to handle food, whether that's bussers, whether that's basically servers, things like that, you have to consider that they're all in direct food preparation, so everybody's gonna have to wear gloves in that case. You wanna train your employees on those new safety and operational protocols. The county guidance is very specific on 3 health screening questions that you have to ask each employee before they start their shift. It's regarding temperature, it's regarding exposure, 2 questions on exposure. So I would encourage you to go to that guidance, because they kind of do set that out. And they were encouraging businesses to keep a log, but the next step was regarding temperatures. A lot of businesses have asked, because they don't have the infrared or kind of the mobile one, the touchless thermometer that you can just check people when they come in. If you're able to get that, that's probably a good way to do it, where you don't have to touch them or reuse it. In the county guidance, they did include that the employees can have your employees take the temperature at home before each shift, and they can report if it's greater than 99.5 degrees Fahrenheit. Basically, you shouldn't record any individual temperatures, because that could get into like HIPAA violations and things like that. So you should basically record in the daily log in terms of pass fail. So you can have kind of like a checklist on what you do in terms of your procedures and to kind of do a check-in. It's also encouraged that when you do the check-in, don't necessarily do it inside the restaurant, because like at your time clock or whatever you do, or the station that they check in, because if somebody's sick and they come in, that's going to have you shut down your whole place. So it's better if you do it outside, because then they're not actually physically entering the premises. In terms of customers, all customers must wear masks unless seated at a table, and they must wear the mask when they get up to leave the table. Self-opening doors are encouraged. If you can't do that, you need to have somebody who can be like a door person to open and close it for customers, because they want to minimize people touching the doors and kind of like grabbing the doors coming in and out. Menus have to be disposable and single use, or you need to be able to have the customer view it on their personal device. So it might be something where if you have a link, you can basically put the link where they can load it up on their mobile device and look it up themselves. Or obviously you can have disposable single use. Disposable silverware is recommended, but they did recognize that that might not be feasible for every business. So what they did say is they need to do silverware roll-ups, the traditional roll it up in a napkin and kind of keep it protected. Use single-use condiments, so mustard, ketchup, mayonnaise, things like that. But nothing preset on the table. So don't leave glasses on the table, don't leave condiments on the table, don't leave silverware exposed on the table. That's a way for different items to get contaminated. So you don't want to preset anything. We only want to put it when they sit down at the table, and you want to take it away when they leave. And then sanitizing wipes or hand washing methods available for each table. Most of the time businesses do have like little wipes that people can use. So you want to incorporate that, or kind of outline what's the hand washing methods for each customer. I do have some additional guidance up there on the, again, on the Miami-Dade County reopening plan. If I didn't cover your industry, or if you want more information, if you're in a restaurant or retail, definitely go there and check it out. It's a pretty helpful document, and it does go through kind of step by step. So now that we did that, let's get into some of the considerations you need when you reopen. I'm going to stress for you the most important consideration you need to do on reopening is you need to have a good plan in place. As we talked about, kind of facility prep, operational prep, the steps you take beforehand are key, and you shouldn't be back open until you have a really good plan in place, because it's kind of like letting the genie out of the bottle. It could basically delay your ability to reopen, to stay open, and generate revenue and kind of keep your folks employed. So as I mentioned though, the COVID-19 prep and operations, it's going to differ among the businesses depending on your industry, your product or service, your location, your size, your type of customers. So you want to take all those things into consideration. I would encourage you, the CDC has a really good interim guidance for specific industries. The link that I provided, it starts on page 42. It's part of a larger CDC document that focuses on kind of like steps the CDC is taking and different testing and things like that. But page 42, it does start industry-specific information, and it has really good kind of step-by-step kind of different operations and things like that. And it goes by industry. So I'd encourage you to check that out. The link is available. And as I said, we will send you the PDF afterwards so that you guys can have that link more easily. I did want to stress for you how contagious COVID-19 is. By now, everybody knows, it's spread basically by coughing, by sneezing, by people touching a contaminated place and touching their eyes, touching their mouth. But this is actually an example from China, from Guangzhou in January. This was a restaurant, and actually the air conditioning is what did it. The person that's A1 was was positive for COVID-19, but they were asymptomatic. They came with their family, which is also seated at the A table. That one person, because of the airflow, contaminated about 7 or 8 more people. So you can see folks at the B table, folks at the C table. There wasn't any diners at the other tables, but you basically have 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 folks that got contaminated from this one person that was asymptomatic. And just multiply that times the number of businesses that are open, and you can see how we got into so many cases. So you want to be very, very careful when you're reopening to take into account all the different safety protocols, all the different things, and especially like they said about changing air filters. You know, if you're able to upgrade your HVAC, that's great, but a lot of businesses, I know that's an added cost right now that you can't incur. Also, a lot of questions we get is regarding signage. We talked about the signage you're required to put in regarding, you know, the CDC guidance, hand washing, masks, things like that. But to protect you, to protect your customers, to protect your employees, it is strongly recommended that you have signage outside that basically is kind of like full disclosure to people that they need to wear a mask when they're coming in your establishment. Also, I know I've seen other signage that does specify that they say, you know, we ask that people that are COVID-19 or may have been exposed to COVID-19 not enter the premises. That way you're kind of like disclosing too, like, you know, don't come in and contaminate people. But I've seen more frequently this one, where basically it is a little more official looking, where it says county officials require that employees and customers wear a face mask or a face covering upon entering and exiting this establishment. So it sets out full, you know, on the front end, basically prominently, like don't come in here unless you got a face mask. So that way you're encouraging kind of proper safety protocols. That also does give you some ability to usher people out if they're not willing to wear it. Because we have seen some of those cases where businesses were, you know, customers were fighting and things like that. I think everybody's been pretty understanding, but you do want to do that. And you also want to train your host or whoever's in the front of the house kind of receiving people to basically kind of catch people when they come in, because you don't want somebody to go all the way into your operation and then basically contaminate everybody. So you want to catch them at the front end, make sure everybody's wearing a mask, they're kind of following proper safety measures. And like I said, that should be prominently placed outside your business and a sign indoors as well. In terms of employee safety best practices, you want to routinely clean that point of sale equipment and also any shared objects between use. Think about like the grocery store, wiping down the conveyor belt, wiping down kind of where the customers come through, doing that after each transaction. Obviously encouraging non-cash payments. I think everybody's been okay with that right now because people don't want to give cash and they don't want to receive cash or coins. But obviously you can encourage that contactless checkout. You know, if you have a mobile card reader where the customer can insert it themselves. If you give them a PIN, wipe the PIN down before you give it to them, wipe the PIN down when you get it back. But I haven't seen a lot of PINs being used lately. Leave the receipt on the counter, let them pick it up. Then you disinfect once they leave. You know, don't hand it to them physically. And then one that's new that I did see was for restaurants. Everybody knows the little buzzer that they give you that tells you when your table is ready. They've encouraged to discontinue those buzzers for table seating, because imagine how many people touch that and kind of where it goes. So they've been encouraging folks to not use buzzers like that, at least until we get through COVID-19. A lot of folks always look to some of the bigger businesses in the industries in terms of what they're doing. On that part about buzzers and kind of waiting in lines and things like that, Disney did open Shanghai Disneyland. They did implement some new protocols there. One of the protocols was virtual queuing up so that they can manage the crowds at the entrance, the rides, the restaurants. They also did put some measures in requiring face masks, contact tracing, basically temperature checks. So they did implement some of those like a lot of other industries are doing. I would encourage you again to check out the detailed guidance and FAQs that are on the CDC's website. They do have really great industry specific information that'll help you kind of get your head around all this. I would also encourage you to check out the US Chamber's website. They do have a good summary of OSHA guidance for businesses, and it basically sums it up. So I did put on there what's the name in case you want to Google it. it's called OSHA's response to work-based safety and coronavirus exposure, but I did include the link up there as well. So we'll give you the link so that you can use it later on. So now that I covered safety, now that I covered preparation, now that I covered local guidance, let's get back to business strategies and marketing. I know that's important for a lot of businesses. You want to get some revenue, get some customers in the door. The most important thing I have to reiterate is any good marketing strategy, any great reopening strategy, it's going to all be for naught if you don't take those proper safety protocols. Consider kind of the roach report effect. You know, roaches and rat reports, you know, they always have restaurants and retail and other businesses that are on there. Nobody wants to be on that report. It's one that you do not want to be on. It's bad from a marketing perspective. It's bad from public safety perspective. So you want to take proper steps because no business wants to be in the newspaper on the news that they had COVID-19 cases, that they had employees that were infected, all those kind of things. That's going to shut down your business. And the steps that they've included for kind of cleaning, it could be as long as 14 days that you'd be down in terms of quarantining and cleaning and things like that. In addition to the negative hits you're going to take on the marketing side, on the reputational side. So you want to basically take those proper steps. Now that I got that out of the way, I know I've hit that point a lot. In terms of a good marketing playbook, Google does have a COVID-19 marketing playbook. It's based on their observations on how businesses are dealing with the pandemic. The handbook kind of frames recovery in 3 phases. They focus on responding, rebuilding, and then recovering and reframing. The marketing strategy is also set up in 3 phases where you use consumer insights to drive your approach, you assess the impact on your business, and you take action. So I did include the link up there, but you can also just Google, use Google. You can use another search engine as well, but the Google's COVID-19 marketing playbook, it'll come up. It's got a PDF version, but it's actually really good for businesses that are considering kind of like what's a good marketing strategy to deal with it. A lot of other businesses, especially professional services, they've been contacting customers with reminders about annual check-ins, annual servicing, things like that, just to get kind of fresh in mind, get on people's radar. And a lot of businesses now, traditionally, they wouldn't do kind of like snail mail or direct mail because people wouldn't be at home. You know, they wouldn't read it. It's better if you did social media. It's better if you did, email, things like that. But given the large number of employees that are still working remotely, I would encourage you to not discount traditional snail mail marketing as part of your overall strategy, because at least for the foreseeable future, that could be a way for you to hit some businesses. And everybody's now looking for the mailman to come, so that they can basically check the mail, see if they got some checks, see what kind of mail they're getting. Maybe they're looking for packages and things like that. So it is one way that you could reach some additional customers. Obviously, consider your social media campaigns, any short video tutorials, since everybody's online and kind of watching a lot of online content like you are. And also any special promotions that you can raise brand awareness. So I'm going to get into some more of those in a minute. Obviously, we mentioned you want to monitor state and local guidance on any changes to occupancy rates, any hours, any additional guidance on facilities or employees and things like that. You want to update your website to let customers know if you're ordering, your shipping, or your inventory is impacted, and when you expect to reopen. You want to review any of your partner websites, any of your competitors' websites, learn about their status, pick up best practices from them that you can incorporate. Basic rob and duplicate, R&D. When appropriate, you want to also plan those special promotions to raise awareness. Thank your healthcare workers, entice people back, 25% off, reopening, things like that. Any way that you can get people in the door or get people thinking about your business. During this, a lot of business owners, if they're in retail, if they're in restaurants, other types, even professional services, they basically have really taken advantage of gift cards. That's a way for you to encourage longtime customers to help put immediate cash into your business. Gift cards can be used online. They can be used in person later. So they don't have to immediately come and use it, but it's an immediate way to get cash back into your business. And it's also a way for you to emphasize buy local, shop small, for business, helping local businesses out. So definitely take advantage of gift cards and set up a gift card program. Also, a lot of restaurants and grocery stores have shifted to those delivery services to compensate for the loss of in-store traffic. When you're doing your marketing in response to COVID-19, you might want to offer discount for takeout orders for restaurants, or if it's a first-time user on a delivery service app. Depending on your location, you can also make it easier for takeout orders by offering curbside pickup, contactless, things like that. I did provide a rundown here on some of the most popular delivery services, from DoorDash all the way down to Instacart. It's important, though, that you do your research on how the deliveries work, how much in fees they charge, the speed in the deliveries are made, and how and when you're going to receive your payments. That's very important on the front end, that you make that you're aware of those different processes and procedures. Also, internally, for your operations, you want to set up how do you handle those third-party delivery orders. You saw from Miami-Dade County, they were very specific in terms of how you have special areas for those deliveries and pickups, how you handle those, because although the third-party app, they're basically delivering the orders, customers are going to hold you responsible if there's any errors, if the food isn't hot, if somebody spills the soup in there, things like that. So you got to have really tighten up your process and procedures on how you're going to handle those orders to get them out quickly, but also make sure people get what they want. Double check the order before it goes out, make sure it's packaged properly, things like that. I know there's been a lot of backlash on those delivery services. So I need to reiterate that for those third-party delivery apps, they do take up to a 30% commission on orders. So while it is a great way to stay open during a pandemic, it's a great way to get new customers, to keep customers, and you can increase your range of service. Those fees can eat into your profit versus your traditional operation. So it's something you need to understand your business finances, you need to understand your operations, and you need to read the fine print, read the agreement before you sign it. Just like anything in business, you want to read the agreement, read the contract, understand everything, ask questions, and don't sign up to something that's not going to help out your business. So, like it or not, pandemics are now going to be part of your business continuity planning. So in the past, when a business owner was doing a continuity plan, they would do hurricanes, they would do road construction, power outage, internet, things like that. You wouldn't worry about a volcano. You wouldn't necessarily worry about pandemics. Now you have to incorporate pandemics into your planning. So now you need to give strong consideration to strengthening your e-commerce and your direct-to-consumer sales. Businesses that had these sales channels in place, along with the marketing to match, saw their sales skyrocket, while traditional bricks and mortar offerings were basically kind of like, suffering through those shelter-in-place orders because nobody was coming to their shop. You also got to consider that a one-size-fits-all marketing strategy doesn't work when you have different localities are open or closed, depending on local conditions. And they have different restrictions or number of cases. Because you see that a lot of the marketing right now, it's been more about brand awareness. It's been more about empathy, thanking healthcare workers, thanking employees, talking about your contribution to the community, your roots in the community, things like that, versus like sell. And you want to ensure that your marketing strategies are agile, and then you can also quickly change it in case you need to based on local conditions, so that you don't have any of those additional costs or any delays of your marketing campaign. So I do have a couple of common questions that have come up. The number one question we've been hearing related to basically, what do you do if a customer resists wearing a mask in the business? And then as we noted, you want to clearly post signage at your entrances and inside the business stating your local requirements on wearing face masks. You also want to develop a policy on how you're going to handle a customer in this situation, with a priority to catch them on the front end, to catch them when they come in, so they don't get all the way in your business and basically disrupt your business operations. Because based on the county guidance, you are able to basically kind of limit people coming in if they're not willing to wear a face mask. And so those are things that you can develop your procedures in place. It can also be something where you can basically set up who you call and who you reach out to if the situation escalates. But you obviously want to handle things in a professional manner. You want to basically outline it's posted, that's information, that's county requirements, so that you can basically kind of minimize and mitigate any particular issues. Also, a question from a lot of business owners was, should I require that all my employees be tested prior to reopening? The answer is no, that basically testing is currently limited to people who are exhibiting symptoms or who have been likely exposed to COVID-19. So instead of testing all of your employees, that's a lot of cost for you or for your employees. It's not going to be feasible given like that they're putting a priority on people that are more likely like either sick or exposed. You should instead conduct those health and temperature screenings at your employee check-ins for each shift so that way you can monitor and do health assessments there. But I would really stress for you, check out the county's, Miami-Dade County's guidance. If you're in Miami-Dade County, they do have kind of 3 essential health screening questions you should ask your employees so that you can kind of check in and kind of nip things in the bud if somebody is sick. And you want to be understanding if somebody's sick, you want to have them self-quarantine, you want to keep in regular contact with them so that you can get them back to work as soon as they're through the quarantine. And then there are some protocols if an employee or customer tests positive. In Miami-Dade County, they did establish in the new normal plan basically what process you should follow. It generally tracks what the CDC guidance is on that, but the business is going to have to close for the shorter of the time it's going to take for all staff to be tested in that case, or for the establishment to be deep sanitized. So both of those, if that's shorter time for you to basically test all your staff and deep clean or sanitize the facility, or 14 days from the date that the employee or the customer was last on site at the establishment. And then the new normal plan does get into some of the additional steps. And they also refer, as I mentioned in the appendix, to some of the CDC guidance on how to do that and what to follow, because you need to basically test, you need to notify, and then you need to clean. So those are the kind of steps in terms of that. I did include in here some of the CDC guidance. I included some of their frequently asked questions documents. The Florida Department of Health has a really good COVID-19 website and resource toolkit. The World Health Organization has a good frequently asked questions document. I would encourage you to check out the Chamber of Commerce because they, as I said, they do break down some of the OSHA guidance, some of the other guidance for businesses. And then I did include some of the industry-specific information, whether that's National Grocers Association, Food Industry Association, National Restaurant Association. They have a reopening guidance. They have some pretty cool checklists for businesses that are looking to reopen. National Retail Federation has a reopening guidance. Also, the Florida Restaurant and Lodging Association has a good one as well. And as I mentioned, we're going to send you the PDF so that you can have access to these links as well. And then feel free to reach out to SBDC at FIU if we can help you in any way. I put up there our website, I put up there our phone number, email address, and then also you can follow us on social media. We regularly post information, also different webinars and things like that are posted to social media as well. So with that, I want to be sensitive to you guys' time and get into some questions. So Brianna, what questions do we have?
Okay. So the first question was, I have an employee who does not feel safe returning to work and has declared she is waiting until the pandemic is over to return. How do I deal with this?
So I know a lot of the guidance has been specific to the businesses that were in that situation, especially for PPP. Like a lot of businesses got PPP and customers did not want to come back to the business because they were either worried or because they were getting unemployment and the unemployment was more generous. For a business owner, you need to make every effort to try to bring that employee back to the business. But at the end of the day, you do need to run your operation. So if you make every effort to reach out to that employee to bring them back, you do need to document everything. So you need to document that you reached out. You need to document that you've made every effort. At some point, though, you do need to reopen. So I would encourage you to talk amongst your team, but there might be some positions that are essential that you do need to get moving and move back. So it can be something where you could hire somebody for that position and then basically keep in touch with that employee once conditions improve, maybe you have an opportunity to bring them back. But I know for PPP loan recipients, they did say that you can actually, because you have certain staffing levels you need to get to, that if you make every effort to reach out and you can document that, then you are able to move ahead and hire somebody else to fill that position, because they recognize that business owners need to get back up and running. So just be sensitive to it, because I understand some people have underlying health conditions, they have some other situations. So you want to see if there's some way you can work it out. But if there's no way to find a mutually decision, then you might have to make some hard decisions in that respect. So.
And then the next question was, we have a childcare center that has been open the entire time. We would like to know if any, I don't think, oh, I'm sorry. If we would like to know if anyone knows when the 10 number will be lifted.
The 10, I think specific to childcare centers, maybe that's 10 children. Did we want to maybe have her on so she could provide more guidance on that? I think that's what she's talking about, 10 children. That was Rose?
Yes. Rose, are you there?
I see she's muted. What I would encourage you, Rose, is to check the new normal plan from the county. It did outline a lot of information. There was stuff specific to childcare centers. So I would encourage you to check that because I think that's going to be the place that's going to have the information. You should also check, depending on what city you're located in, because there might be additional local guidance from them on that. But I think that that is either a county or a local restriction. It might be something that's specific to phase 1, but it might be something that they basically lift as part of phase 2. So I would say kind of just monitor the county guidance and kind of see what, when it is. But it seems to me that that might be a limit of 10 children per childcare center, perhaps. So do we have any other questions?
That was the last of our questions, but I just wanted to go ahead and reiterate again that we will be sending out the presentation as well as posting the video from today on YouTube. And our YouTube page is FIU Entrepreneurship, the same as you see the Facebook page. It's the exact same. That video should be posted no later than the end of this week.
Okay. And what do you guys think? Was that good? Good information? You can put in the chat. But we really appreciate you guys. We appreciate everything you guys are doing to get your businesses back up and running. We hope that the information was helpful in terms of kind of giving you some additional guidance, because I know there's a lot of anxiety. There's a lot of, obviously, as you saw from the presentation, there's a lot of information out there to kind of navigate. So definitely count on SBDC at FIU if we can help you in any way. There's a lot of other great groups in the community as well that's helping, ranging from cities, from other small business providers, from the county. There's a lot of other groups that are available to help you too in terms of navigating this and getting to the new normal. So just thanks again for everything. Be safe, and then just good luck with your reopening strategies. And we're gonna all get through it, guys. We're gonna get through it and be back to normal in no time. So thanks again.